Okay, so can everyone see my screen then?
I can see it, yeah.
Yes.
Perfect.
Okay, perfect. So thanks for asking me to come and quickly give you a quick snapshot of some of the things that I'm doing in my lab related to using technology to assess and manage pain. So I'm not sure I'll get through future directions in terms of some of the other tech stuff I'm doing, but we'll see how it goes. I wanted to really take this opportunity to just maybe use one example of how I'm using technology, in this case, apps, to help better assess and manage pain in kids with cancer. I know you're interested in KT strategies, so I'll talk a little bit about some of the strategies I used with Pain Squad. I'll probably end with some of the opportunities and challenges, and if I have time, I will talk about some cool new things we're doing in our lab in terms of using a robot for procedure-related pain, now moving into things like virtual reality, although it's been about 15 or 20 years, it's still not used in everyday clinical practice. And then we're also working on a post-op pain app. So in terms of setting the stage, I think everyone here is familiar with kids with cancer, and pain is probably one of the most distressing symptoms that they have, and it can be related to the cancer itself, but most commonly the treatment and obviously some of the painful procedures that they have to do. And despite having good treatments, cancer pain is still poorly managed, and it has long-lasting effects. It can affect their sleep, their mood, result in anxiety and distress, impedes recovery, and not only distress for the child, but also the family. So it's really important, obviously, to try to reduce pain to maximize quality of life. And especially in cancer and in a lot of other situations, we're moving a lot of our care from the hospital out into community-based hospitals or even in home-based settings. And symptom reporting in terms of kids with cancer, kids don't tend to report it in real time. They tend to report symptoms they're having related to their cancer only when they go back to the hospital. Surprisingly, even though cancer pain is really common, there are not a lot of tools that allow us to track pain in real-time settings, and most of the tools that are out there are symptom cluster tools, so they assess pain and a whole bunch of other symptoms. And in the old way, we used to ask people to keep diaries and keep track of their pain and symptoms, and the new way is really using mobile technologies. And so that's where we came up with this concept of using an app to track pain, and our first app we created was called Pain Squad. I tend to use a user-centered design approach, and I'll talk about that a bit more in a minute, but I use a stepped approach to really develop these apps, because just because we can develop them doesn't mean it's the right solution for every problem. So for my PhD, I developed one of the first electronic diaries. It was using a tungsten palm, which are prehistoric now, in youth with kids with arthritis. And so I used the same sort of suite of questions, and I got a meeting grant from CIHR to bring in experts in oncology, pain, and young people with cancer to help us revise what questions should be in the app. We then did a scoping review of all the apps that were available, and I'll give you the data on that. We then developed the app. We did content and face validity testing, usability testing, really just to make sure it's easy to use and understand. We did feasibility testing where we gave the app to young people undergoing cancer treatment for 2 weeks just to see that how compliant they were, whether they were having technical difficulties. And we just finished a study in 4 centers in Canada looking at the reliability and validity because, again, we're changing the mode of asking these questions, and we want to be able to make sure that we have a reliable and valid tool to use in their future outcome studies. So this is that scoping review I mentioned. So back in 2014, at that time, there were just under 280 apps. You can see that the majority of them provided sort of self-care support. Half of them provided education. Despite there were apps that could track, only about 20% of them monitored pain, and very few provided social support. But what really got me interested as a clinician and researcher in this area is that only 8% of these actually involved a healthcare provider in their development. So these are being developed by programmers who have no clinical knowledge. so which is quite concerning. And then when we went to look at each of those apps, only one was being currently evaluated in a scientific study to see if it was actually reliable or valid or actually made a difference in patient outcomes. So this is that user-centered design approach that we use. We sort of analyzed the requirements. As I said, we did the needs assessment with the healthcare providers and patients. We design it, we refine it using usability and feasibility testing, and evaluate it, and keep doing that in our iterative cycle. I'm just going to quickly show you a video of the app.
This is the hospital for sick children in Toronto. Within these walls every single year, thousands of children are battling cancer and are having to undergo terribly painful treatments. Children like Olivia, who 8 months ago was diagnosed with Ewing sarcoma. The hospital is continually trying to minimize this pain, but to do it, they must first understand it better, and most importantly, discover the medications that are working best. To do this, they need these young patients to record exactly how they're feeling in a pain journal. The challenge is that after multiple chemotherapy and radiation treatments, many kids are too tired or discouraged to even hold a pen, much less keep a detailed journal. And the sad reality is that if this data is not collected data, it's useless. We needed to find a creative solution to collect data every single day. And with the Pain Squad mobile app, that's just what we did. To begin, our patients were enlisted as recruits in Pain Squad, a special police force dedicated to hunting down pain. We gave each recruit an Apple iPhone loaded with the Pain Squad mobile app. Then twice a day, an alert from headquarters told patients it was time to complete their pain reporting mission. Because the reports worked with iPhone's user-friendly touchscreen, kids could easily fill them out. With a simple flick of the finger, they could identify exactly where and how much it hurt, as well as which medications were working best. But making it easy was, well, the easy part. We needed to be truly successful. We needed to find a way to encourage our young target daily. So we called in some police reinforcements.
Hey, Rookie. Welcome to Pain Squad. It's really great you're here. We need all the help we can get to help put pain in its place.
We brought together the casts of Canada's top police dramas, Flashpoint and Rookie Blue, and filmed a series of inspiring videos, then deployed them throughout the app. To encourage the kids to fill in their reports, we created a graduation structure. When a recruit completed 3 reports in a row, they received a message from HQ informing them that they were moving up the ranks.
You are now officially a full-fledged detective in Pain Squad. Well done. At this rate, you might even be the next chief.
Don't stop now. You're almost there.
You truly are one of Pain Squad's best and brightest. Keep it up.
Back inside the precinct, recruits could check to see when to fill out their reports and how many badges they had earned. And once their last report was filed, they were sent one final message informing them that they were being retired from the field.
But this case isn't closed yet. Your squad is still fighting. You couldn't have done it without you. So way to go.
The app is an excellent tool. That's her control over the pain, because she's able to document it herself that she's using the app. She just glides right through it, and it makes her feel that she's a part of this. It's fantastic that you're already able to come up with this. It really helps.
Just got the word from Chief. Turns out you've been doing so great, it feels like you're ready to move on. You're well on your way to putting pain in its place. Don't stop now. You're almost there.
Congratulations.
Cool.
Sergeant.
So in this app, we use this concept of gamification because in previous sort of diary studies, people incentivize people to complete them by paying them. And so we actually wanted to use gamification where they could move up the ranks to internally motivate them. And over a 2-week period, in just under 100 kids that use the app, where they were asked to do it twice a day for the 2-week period, we had an average of 90% compliance, and so that's sort of unheard of in the diary world. So this notion of gamification really helps with the adherence piece. This is just showing you that we actually have finished the study, look at the constructability and reliability and responsiveness of the diary, which was recently published in Pain. And I want to show you this because this is the data collected from that study where we did the validation in 92 adolescents. And you can see that 96% of them had pain on the occurrences when they filled out the app. And 13% had pain on every single report. Pain currently tends to be sort of in the moderate. Worst pain is sort of in the low severe range, and it is interfering with activities of daily living. But what really got me thinking about our next project, Pain Squad Plus, was this is the data on the strategies that they used in the last 12 hours to manage their pain, and we asked them about medications, physical and psychological strategies, and you can see that they're not, only half of them are using sort of medications that are prescribed, and very few of them are using psychological or physical strategies. So our next project was to see how could we use this tool to now, in real time, based on the inputs that they were providing into the diary, provide them with real-time advice to manage their procedural or more persistent pain. And so Lindsay Jibb, this is Lindsay here, is a PhD student in my lab, and she has done the studies looking at the development and looking at the effectiveness of Pain Squad Plus, and this was funded by CIHR and Alex's Lemonade Stand. So as I said, Pain Squad Plus builds off of the pain assessment tool in Pain Squad, where it has the daily assessments. There can do ad hoc assessments if they have pain throughout the day. Then based on the assessments, we built an algorithm with experts again to push advice to the teens in terms of distraction, physical strategies, those types of things. We did interviews with healthcare providers, and they said that actually severely managed or poorly managed cancer pain is sort of an urgent issue, and they felt there should be some sort of clinical support. So in the context of this research study, we had a nurse who would get alerts based on the entries if they were severely managed over 3 entries, and then the teens would be asked to reevaluate their pain after they had actually used some of that advice. These are just some of the screenshots, so you can see there are ones that are recommended to you based on the algorithm. Some kids with cancer already know strategies that work or don't work, so they can sort of pick their own. And we have strategies related to procedures that they might undergo or just general pain that they're having from their cancer. And you can see these are just some examples of exercises, mental games, rehearsal, muscle relaxation, imagery, all those kinds of things are within the app. Again, we actually changed the reward structure, so now we're rewarding them for actually using the advice versus doing the pain assessment entries, and you can see that we stick with this sort of same sort of reward structure. So in doing this, again, we use this phased approach where we sort of came up with the concept based on the data from the last app. We designed it. We did usability testing. We've just completed a pilot study, and I'll just quickly show you some data on that. So this is Lindsay's project, was to determine the feasibility of implementing this app and also to try to determine some preliminary estimates of effectiveness using a one-arm pre-post test feasibility study. These are the types of things we looked at, like can we get kids into this study? Are they dropping out? Are we having technical difficulties? Are they adhering to the protocol? We looked at the nurse protocol. What was the acceptability of it? And then we looked at estimates of its effectiveness in terms of reducing pain, pain interference, quality of life, and their self-efficacy for coping with pain. So again, we used a convenient sample of adolescents 12 to 18. They had to be undergoing cancer treatment. And so, again, we recruited them, did baseline information, the intervention, they used the app for 28 days, and then we did post-test measures, and of the teens, we were going for a sample of 40. We interviewed 20 of those, and again, you can see we had a very high recruitment rate, 72%. This is the dashboard that the nurse would see in terms of alerts, and again, an email went to the RN nurse when adolescents reported severe pain sustained for 3 times in a row. And you can see the mean age was about 14. We had more boys than girls, but we had a variety of diagnoses in terms of cancer. This is the data from how easy it was to use, and this is on a scale of 5. So you can see for the most part we had over 4 ratings. The 2 areas were enjoyment and the time it took. And so we had a lot of feedback from this as well as the interviews where the teens said they liked doing it, but the same questions every day were too long and it could be shortened. So we actually have a study now where we're actually shortening the diary questions. But you can see people like using it, and some of them would even use it much longer, even up to longer than 8 weeks after. And then this is what's most promising for us, is that you can see in terms of effect sizes, at least for reducing pain, we have sort of small to moderate effect sizes. Interference scores, again, are small, and self-care is negative, which means that they actually have higher perceived efficacy in terms of feeling better able to control their pain. So this is quite promising for us, showing that this app actually does in fact reduce pain. And Lindsay's now just analyzing. We did some cost effectiveness analysis in terms of how many times they called their healthcare provider, went back for poorly managed pain, and we're still analyzing that. So hopefully we'll have some interesting findings there too. But again, I always like to do qualitative work as well, and so these are just quotes. I liked how the app would suggest things like relaxing and breathing and how to do that, and I just click on it and there's someone talking to you, helping you do that. There was one patient that actually I had from the chronic pain team that was enrolled in the study, and they actually thought that the app helped them communicate better with the team. They could actually print PDF reports and use it to help communicate with their healthcare providers. And again, people really liked the questions. They were easy to understand, and they could understand what they're getting at. This is just the nurse contacts. So the nurse was contacted by 13 patients 29 times. This is the alerts. And the nurse only contacted the primary care team in 4 instances, because usually by the time the nurse got back to the patient, they had already used the advice and their pain was under control. The other issue we ran into is that we actually had to loan the kids the iPhones. So most kids had 2 phones, and we were calling the study phone and the kids weren't picking up. And so one of that was because in the future we would try to have it so that they could upload it to their own phone. Let's just see. But in the end, when we asked the teens about having that nurse alerts, they thought it was nice that someone was sort of watching what was happening, but they often did not use the service, and because they had already used the device and they felt confident in their own capacity to manage their pain. And this is really good for us to know, because now we can go back and sort of maybe remove those alerts, which would make it a Class 2 medical device, which is one of the limitations as well. I'm just going to quickly mention a couple of the KT strategies that I thought were quite helpful. So one of them, we obviously created that YouTube video that I showed you, and that was really geared to patients and families as well as healthcare providers, and we actually entered this in the CIHR ITSE competition the first round, and we actually won second place, which was great. So you can see the value of these videos. We have done lots of things like infographics. This was actually for Cancer Consumer Day that they were having at Sick Kids. So this was geared to patients and families. So this was telling them about the app. In order to help get clinicians at Sick Kids to prescribe the app to patients, we actually created this business card for Pain Squad that they could actually hand out in the clinics. And then I've sent this to other people. For example, Sloan Kettering's using the app now in New York. We've done lots of things on Twitter in terms of when it was launched and updates. I've recently written a blog. I've done lots of television sort of stuff. This is the TDO. They had last year a documentary session on cancer gaming, and of course media releases and the traditional publications. But I think some of the big challenges, why there are great opportunities using this technology, there are challenges, and I really encourage people that if they're going to develop these, they should really co-create them with the end users to make sure that they have something that's really going to be stickable. I don't know if you guys know this data, but most people just download an app once. They never use it. Only 5% of apps are used for more than 30 days. So we really need to figure out what is going to keep people stuck to using that app to result in behavioral change. Again, the landscape is changing so rapidly in terms of technology. It took me 4 years to get Pain Squad from an idea actually into the hands of patients and families. The cost to develop them, now if you're going into funding bodies, they want this cost effectiveness analysis because it can cost up to, you know, 100, 150,000 to build these really stickable apps. And so we really have to do these analysis to show that there are benefits in terms of cost savings. Obviously, issues of protection of personal health information, so everything needs to be encrypted on the app and when sending it. Now we're looking at issues of how do we integrate this data within the electronic health records. So as I said, with Pain Squad, the patients can actually, these are patient-driven apps, so they don't automatically link with the EHR, but patients can send their providers printable PDFs. Again, that concept of gamification to internally motivate people. And again, scalability. So for Pain Squad Plus, we are thinking of removing the nurse alert. Otherwise, we'd have to license that, and it would be a Class 2 medical device. And then how do you sustain these over time as that technology changes? So it's, I don't know, it's been about 25 minutes, so I have a few more little projects we're working on in terms of technology, but I'm happy to stop here and we can chat about this, or...
This is Lisa. I'm interested in what you're saying. I don't know about Ash. I mean, we're all interested. I think we're
okay.
Going.
It'll be quick. It won't
Yeah.
be too fast. Okay. So one of the coolest things I think we have in our lab right now is Medi, who is a robot. Medi is about 3 feet tall. He has motion, tactile, and pressure sensors. He can distract and entertain. He was originally developed in Germany, and he was tested initially in elderly to help them to remind for their medications, pick up papers, things like that. He can tell stories, play games, dance, but we've actually been working with Tanya Buren, who's a psychologist at Calgary Children's, where she's actually developed programs to program Medi to help with various procedures. So she's already published a couple of studies with Medi helping to decrease pain and anxiety related to immunization pain, blood draws. I think she's developed a total of 12 programs now for G-tube insertions, suction, things like that. And so she's developed a program in collaboration with us for port access. And so we're doing a study right now looking at how feasible is it to use this robot, just because it takes time to sort of set up and interference in terms of workflow in terms of the nurses. But we're also looking at how this robot can be used to reduce pain and distress compared to the robot just dancing. So I'm just going to link out of this program just for a second to show you a little video. Oh, if I can find it. It's on my desktop.
I know. So this is patient number 1. Yeah. The date is February 8th.
You can see she's not too happy.
Isn't it great? Are you doing it for laughing? I'm gonna keep you warm. Okay. Why are they not talking?
Oh, you're gonna talk in 1 second.
Okay. Let's put your necklace in behind. Okay. So I don't want to clean your necklace. I'm going to put it on your shoulder, put it on your shoulder there.
We're here and get to visit with you.
You gotta hold this up.
And we have a lot of kids and they should be really cool. I'd like to share it with you. You do it with your nose and mouth. It's called belly breathing.
1.1.
You can do it whenever you're scared. My battery answers. Take slow breath into your nose. Let's do it together. Here we go.
Oh, 2 more.
Hold your breath for 2 seconds.
4 days. It's the big 4 day.
Let out your air slowly through your mouth.
I'm going to speed it up to show you when they actually see the port.
Another tab. It's another tab and maybe a robot. Am I going to count to 3 for you now? You want to count to 3? Or no counting? No count? Yeah? Okay. So 1, 2, 3. Okay, so I'm going to put them on.
It will feel like cool air on your skin. I wonder if you have ever felt the rain on your skin. It's cool, but only in short time. Keeping the skin nice and
breathing.
healing charge more quickly.
Totally distracted.
You can guess what.
So you can see from that procedure, this little girl was actually quite angry and upset going into the procedure, and she was totally distracted and engaged despite all that activity that was going on with the mom and the nurse. So the next thing that we're looking at, I'm partnering with a virtual reality programmer in San Francisco, and virtual reality is really using a computer technology which simulates an environment or a world which is sort of engaging and has visual, auditory, and tactile stimulation, so sight, sound, touch, and it can be sort of either immersive or non-immersive. So non-immersive, you can still hear what's going on around you, to fully immersive, where you're fully engaged and you're not aware of what's going on in your environment. And so this is actually the underwater game, a virtual reality game that he's developed, and he's modifying it specifically. Again, we're looking at it in children, older children, because Medi we're using in sort of 4 to 8-year-olds. The virtual reality tool we're using in 8 to 18-year-olds. And they can actually, it's gamified, so they have a little hand sensor that remote controller that they can use, and when they see various fish, you can see it back here, they can click on them and win points, and there's a leaderboard so they can compare themselves to either their previous use or other people that had played the same game. The last thing we're doing is we're sort of building off Pain Squad and developing a smartphone app to look at management of postoperative pain. So in Canada, we do more than 8,000 pediatric surgeries a year. Most of them are day cases, and so that's what we're focusing on initially. And there's been lots in the media recently in terms of articles showing that despite adequate treatments, a lot of kids are suffering with moderate to severe pain after surgeries. So we've actually tried to address this by developing this bilingual smartphone app for 18 to 18-year-olds. And again, we're using that same phased approach. We actually had a competition at Sick Kids called Taking Sick Kids Mobile, where we partnered with Ryerson OCAD, which is the College of Design, Art and Design, who else? George Brown. And so we developed a basic prototype. We then actually got funded by the Innovation Fund at Sick Kids to do a needs assessment of patients who had undergone surgery, their parents and healthcare providers, to inform what should be in the app. Jill Chorney is just recently, it's in press, published a review of psychological strategies for the management of postoperative pain. We then were funded by CIHR to actually bring together experts in acute postoperative pain, patients, and then mobile health developers to develop the algorithm, which we finished, and we're now just applying for funding to develop the app. And these are just some basic prototypes from that competition that we were in. So you can see, again, they can create a profile. They'll have a toolbox that they can use in terms of mainly psychological and physical strategies. They can set goals. They can track their pain. This is just some of the basic tracking. And these would be interventions, and again, we'd break them up as sort of by body, mind, and medication sort of interventions, and then goal setting. So I think in conclusion, at least related to apps, I think they show a great mode of tracking both acute pain, and I also do stuff in chronic pain, and to help deliver these self-management interventions that people can use wherever they're at. And young people, as you can see, we have no problem recruiting for these studies because they love the technology, but more importantly, it can really increase the reach because kids don't want to come down to hospitals for these types of therapies. You can see that they're not reporting their symptoms to healthcare providers. And then that we're trying to use these other tools like Medi and virtual reality that can be used to help reduce acute procedure-related pain and distress. And this is just my lab, and I'm happy to answer any questions you guys have or talk about potential collaborations. for how this can be used in your work.
That's great. Thanks so much, Jennifer. That was a really good presentation. I do have one question for the Pain Squad app, or Pain Squad Plus. It looks like you did a lot of knowledge translation stuff externally to put it out to clients and families, and a bit for clinicians. Did you find you had to do any sort of implementation work with the clinicians to get them on board with using it with clients?
Yeah, so that's why I was saying we did present it back locally, and it's interesting. It's I don't know why this always happens. This happens to Bonnie too. Is when you create things locally, people outside tend to want to use it, but not those people locally in the hospital. So that's why we actually developed those cards, and we just administered them a lot to actually not the physicians, but the nurse practitioners and the units and the nurses, who have probably been our biggest champions in terms of promoting it with patients and families on the ground. But if you guys have other strategies in terms of, the other things I forgot to talk about, we did partner with people like POGO. There's the Cancer Knowledge Network, which is a network of patients and families. It's across the spectrum, so it's not just pediatrics, but they've been a huge promoter of my work, and they've promoted it in terms of blogs, trying to get it out to patients and families. So I think partnering with those types of groups who can help get it to patients and families as well as healthcare providers is helpful too. But if you guys have other strategies, I'd love to hear your thoughts.
I mean, for the Pain Toolbox at Holland Bloorview, we did these things called huddles, where on a weekly basis we were in connecting with the clinicians that were using the product. And that was really helpful, but you can only sustain that for so long, right? So.
Yeah.
But you didn't do any sort of like force function kind of thing. I don't know how you would have done that, but like it was up to the clinician to prescribe it. Is that what you're saying with the cards?
Because it's up to the clinicians, and we did have posters up and stuff like that for the patient areas, and for a while oncology was showing the video on the screens at the kids and stuff like that, but it's not integrated with electronic charts, so that couldn't be forced or sort of whatever that way. It's really a patient-driven tool, so again, we tried to target both the patients and the clinicians. But yeah, I think that's one of the issues, is how do you sort of really, once you have a tool that you know works and patients and family really likes, sort of getting it adopted on a larger scale.
Yeah, and I guess in this case it was patient-driven. So I guess you found that. Do you think that's more effective to have it patient-driven versus provider-driven?
The issue is that as soon as you get to things like nurse alerts or having like a medical person within the app, then it gets classified as a Class 2 medical device, and then you can't just put it up in the Apple Store. It has to go through Health Canada. It has to be licensed, and there are so many road barriers to getting it adopted. So that's why for Pain Squad Plus, we're going to remove that now that we have the data that says the kids actually use the advice and they don't. It's a nice to have but not essential. We have the data now that we could remove it, or at least do a trial now where we could have Pain Squad Plus with and without the nurse and compare it. But it would be a huge barrier. As I don't know, I think Anna's on the call, but Sick Kids has had a mobile strategy, and now sort of with budget cuts and now looking at a new EMR, they have no more mobile strategy, so we don't have the support to do that. So that's the other thing. If you're going to sort of do these kind of mobile innovations, you need to partner with people that can help you sustain them over time. And so that's why I've actually partnered with Dr. Joe Capazzo at the Center for Global Health at UHN. He's building all my new, I've got a chronic pain app he's building. He's going to be building the post-op pain, because they have 80 people in their center, and probably half of them are into sort of app development and design and testing. And by partnering with him, I can ensure that sustainability over time, because the research grants don't include that kind of money.
Yeah, that makes sense. Okay, that's great information. Thanks.
Jennifer, this is Samina. Thank you very much for this talk. It was very inspiring and interesting to hear. I'll mention I have a colleague, Dr. Amy Drendel, who's in the U.S., and in fact, while you were speaking, I was so excited I actually fired her off an email and said, you need to connect with Jennifer. She has developed an app that she's using for her area of research is acute pain related to musculoskeletal injury, and she's a pediatric emergency physician. And she's done a tremendous job of working with the team to develop an app to collect data more in the research context, but it's all around pain questions as well. And the idea of gamification, like my eyes just lit up when you said that, because that's where you get that engagement from the end user, who in our cases, both of our cases are children, right? And so I said, do you know about this gamification? Are you using this? And so I hope, if it's all right with you, that if she wishes, she could connect with you, if that's all right, because I think there's some synergies, although the populations are different. I think you two are on a similar wavelength in terms of
Absolutely, for sure.
And then a comment to say in relation to what Ashley, to build on what Ashley was saying, was about aiming this towards the children rather than the healthcare providers. More and more, certainly in the emergency department setting, which is my personal setting for clinical practice, where our research, we're moving towards patient engagement and family engagement. We recognize, and I say this as a clinical person myself, that clinicians are miserable to get to change their behaviors. We like to do things the way we've done them, and so but when the pressure, if you will, or the push comes from the patient, it's very hard for a clinician to say no. So that I commend you for focusing this on the children and empowering them, as I think they actually have a very strong voice that we weren't tuned in to hear in the past, and now we're recognizing that it needs to be heard. And you're harnessing that.
Yeah, no, I would totally agree with you. And that's why I think for co-creating this, like we have a group of kids with oncology, and the pain app we're developing, the post-op one and the chronic pain one. There's a group of about 15 to 20 kids that have been involved in our testing that, had we not involved them in the development, and what we would have envisioned and what we actually developed would have been two totally different things, and it totally would have failed. So I think in all, engaging them, making patient-driven apps, but engaging them in the whole process is really important as well.
Thank you so much for sharing this. Very, very, very interesting work. Very forward-thinking.
No problem. I know you guys have other things to discuss, so do you want me to drop off, or?
Sure. Thank you again very much for your time.
Okay, great. Thanks, guys.
Okay, bye.
Bye-bye.